Well, this week we found out that Social Security and Medicare, the dates for insolvency or the dates for when they are going to run out of being able to fully fund these different things has been pushed back a little bit, but still the alarm bells are being raised about the long-term viability of these two entitlement programs to the point where we have heard lawmakers talking about, again, different ideas, different things that could be done in order to make these two entitlements something that won't expire in the 2030s. And joining me to talk a little bit more about this, Richard Stern. He's the director of the Grover M. Hermann Center for the Federal Budget at the Heritage Foundation. Richard, thank you for joining me here on the DC Debrief. How are you?
Doing well. Thanks for having me on today. I appreciate it.
Good. Thank you for joining me. Now, did I describe that accurately? Because I know that there's a couple different ways that this is being spun. I think there has been some framing of it as good news, that the fact that these dates, at least for Medicare, got pushed back by a couple of years, and for Social Security by a little bit as well. But it seems as if maybe that's just like a pebble in the ocean in terms of where the problems that we're looking at here. So is that a fair assessment of what it is that we found out this week?
Yeah, absolutely. So this is, imagine you're in a car, you're charging towards a brick wall, and the brakes aren't working, but the wind picked up a little bit, so the car's going just a little slower at that brick wall. That's kind of what this is right here.
Okay, so let's break this down. Let's talk a little bit about what's going on here. Medicare's go broke date was pushed back 5 years to 2036. Let's start off with the Medicare portion of this. So push back a few years is great. That's wonderful. Why is that? Why has it been pushed back 5 years?
So, part of what we're looking at, frankly, is the lingering effects from COVID a little bit. So COVID had some morbid things that actually would mean that we're going to spend less money in these programs, which is really to say, and I think this is an important thing, by the way, that part of what both Social Security and Medicare do is they steal from workers now, many of whom do not live to see the benefits. Now, if this had been money they could keep, they could invest for their retirement, at the very least, they could leave that money to their heirs. They could leave that money to their spouse. They could leave it to their children. And for many people, this is the money that buys a house. This is the money that could pay for their kid to be able to go to school and get a better job. And so what you're looking at here, right, is a program that is very much a little better off financially based on the backs of people dying and not being able to get the benefits that they were promised after being robbed their entire working life by the government. And I should say there's a few other things, right? So medical costs haven't grown quite as much as a few little tweaks. I should say as well, though, it's a little misleading the way that they publish it. It's not really that Medicare is pushed back 5 years for going bankrupt. It's a very, very small portion of Medicare that is on the trust fund. The vast majority of the program is already bankrupt. It borrows from the general fund of the Treasury. You can read that as your income taxes every day of the week.
So let's just understanding that point, and that point is well taken for sure. What happens, say, in 2035? Let's say, 2036. Let's say nothing changes between now and then. What happens when those reserves do eventually become depleted?
Yes, and I think that's an important thing to look at. So the trust fund in Medicare is the Hospital Insurance Trust Fund. So this covers where Medicare pays hospitals for services you use if you're elderly, if you're on Medicare. If it runs out of its resources in the trust fund, it is limited to spending only the payroll tax collections that it takes into the trust fund. So what you'd be looking at is a automatic overnight, like you're hitting a brick wall, just cut in the money Medicare will spend, which really means that seniors aren't getting their services, the doctors aren't getting reimbursed. What you're going to be looking at is pure chaos in that. So it's important, right, to not just let that happen lazily, frankly, as the left and as Biden's been trying to push for.
Let's talk about Social Security. Their trust funds cover old age and disability recipients for about 71 million people in America. They would be unable to pay full benefits starting in 2035. So instead of last year's estimate of 2034. So again, a year, like you said, wind change, brick wall, all that. Social Security would only be able to then, I think, pay about 83% of benefits once that date hits. Is that right?
It's a little lower than that, 79%.
Okay.
And I should say as well that, so that's just on day one. But the truth is the trust fund, let's say we continue the trajectory we're on, the trust fund will never again have a dime saved up. So you will be again like the Medicare trust fund. capped at only payroll tax collections to pay off the benefits in perpetuity. So it starts at a 21% cut, but that cut is going to go past 30% within our lifetimes, for example. So that'll keep mounting and building as the program continues to be capped that way.
We do hear people say a lot, well, Congress needs to act in order to avoid cuts to Social Security benefits. What does that mean? What does it mean that Congress needs to act? What could Congress do? What should Congress do, if anything, in your mind, in order to kind of avoid the brick wall?
Yeah. So I think that this is actually a perfect example of where the government frankly screws people over, steals from people, over promises, and creates pure chaos. So I think one of the important things to recognize here is that both of these programs, but Social Security in particular, is very much holding the wolf by the ears. So the government, on one hand, is stealing 12.4% of everybody's paycheck. That isn't progressive. It isn't only the wealthy people. You could be a minimum wage worker working 20 hours a week, and a full 12.4% of your paycheck is being stolen by Social Security. And that's just Social Security. But then the other side of it is the government is taking that money and blowing it on normal deficits. So when you see Ukraine getting money for arms, $100 billion going overseas to fund foreign wars, and you say to yourself, I wonder where that money is coming from. Part of it is your Social Security money. So what happens is the government steals this money from every worker in America, money you could invest to build for your own future. The vast majority of Americans, I know this is going to sound shocking, but the vast majority of Americans could retire as millionaires and multimillionaires if that money was left for them to invest and save on their own. So the government steals it, but then because it blows it on Ukraine funding and block grants to liberal run cities, there isn't any investment going on. So the government's promises of benefits are far in excess of anybody's ability to pay it. So the problem is that the government is massively overpromised benefits while massively stealing from people so they can't save for their own retirement. So, at the end of the day, what we have to do is work on a way of preserving the benefits as much as we can while stopping the theft from people's paychecks so people can be free to save on their own and not trapped to go down with a sinking ship. And it's just one of many things the government does like this.
Well, that sounds great. But what is that? And I guess that's the solution that Congress needs to come up with, or somebody like a group that's going to work solely on this issue. And I'm sure there are some out there like that. What are ways in order to do exactly what you just described?
No, and I appreciate it. And so the Heritage Foundation has put out actually a lot of material, kind of what we would envision as the proper blueprint to do those sorts of things. I wanted to give kind of the high level of the why and why we're looking at that. So I would start by saying this, in our mind, the two kind of easy places to go for, and, nothing's easy when it comes to Social Security, of course, but we think kind of the best two is, one, we'd flatten the benefit. So, the program was designed to be an anti-poverty program for seniors. And the truth is, if you're very low income while you're working, it's not an anti-poverty guarantee. And if you made a lot of money, Social Security gives you back a lot of money. And so we would kind of break that tether and make it more of an anti-poverty program. So higher benefits at the front end, lower benefit, for people that were lower income when they're working, and lower benefits for people that earned more while they're working. Now, to be clear, we're not talking at all about changing benefits for people that are currently retired or near retirement. We're only talking about for people who are a decade or more out from retirement as they're coming into retirement. Then the second thing is changing the full retirement age. So, part of this is the full retirement age was set when people only had a few years to retire. People are routinely living, good 19 years into, past that age now.
Mm-hmm.
But the other thing about it is, if you think of it this way, people who are dying early, people who tended to be a lower income, they're not making it to the full retirement age, but then they're losing their benefits. It's really the people that are getting these benefits are living very long lives who tended to not have, harsh manual labor jobs, people who do make it well past the life expectancy numbers. So at the very least for them, we should adjust the life expectancy number that Social Security is pegged to reflect those real changes in longevity. And you can do it in a way where you're not making it worse for people that were low income. You're not making it worse for people who might end up having shorter lifespans, but you can set up in a way where it's fair where we're not just throwing benefits to people who are going to live a very long life, who made a high income while they were working, at the detriment of higher federal deficits now, and at the detriment of starving, young people now from saving for their retirement. So those are the two kind of broad things that I think are good spaces to look into, right? So flattening out the
Hmm.
benefit curves, changing the full retirement age that's pegged to the program. I should say one other thing, so the program isn't just old age and survivor, it's also people on disability. The truth is, various liberal administrations over time have used kind of little wiggle rooms in the law to make the disability part of the program pay out an enormous amount of benefits to people who are frankly not disabled, who frankly still work full-time jobs. So they've very much corrupted the intent of SSDI, the disability
Hmm.
portion of it. So we have a whole host, about a dozen or so reforms we would do to the way those things are reviewed, to how we assess, whether you're disabled or not, to really make sure that it's a good program that preserves benefits for those that can't work a full job, that are disabled, but it doesn't just become this kind of backdoor welfare program that's sapping the trust fund at the expense of everybody else on the program.
So what would you talk about raising the age? What do you think the age would be increased to? Would it be a 2-year increase, 3-year increase? Would it be develop and evolve over time kind of a thing?
Yeah, so we would have it be either 2 or 3 years, frankly, is a good, and that's a little bit of kind of what Congress is willing to do. But
Hmm.
we wouldn't do it overnight for sure, though. So, the last reform we had actually took decades to get all the way up to the 67 that's currently the number. So we would take it to 69 or 70, but we'd have it phase in over a long period of time as well. But then to your second part of the question, we'd have it indexed to life expectancy thereafter. So that would be incredibly gradual, but it would mean that instead of what we had, which is decades of some people getting benefits and decades of other people losing benefits, to then wake up and say, oh my God, we need to move it 2 or 3 years overnight.
Hmm.
If you index it, it's a very, very gradual change. It keeps things up to date that way. But I should say one other thing about though, if you're listening to this and you say, wait a second, what about people who didn't make a lot, who've been working right out of high school, who aren't going to live a very long life? The way Social Security works is you really can think of that full retirement age as kind of a midpoint. You can retire actually as low as 62 or as high as, and I want to say right now it's 71 right now, and get higher benefits.
Hmm.
So changing that middle age changes the distribution of benefits. But if you do our full set of programs where you increase benefits for low income seniors, they won't be affected by the life expectancy change. So if you do it together, right, it's a way of preserving the benefits, in fact, increasing them for people who've been working their whole life right out of high school who do want to retire at 62 or 63.
Now, I know folks who are on the opposite side of the political spectrum from you would like to see an increase on the taxes that are being paid by the highest earners in America. And see some of that money filter down into the program. What, in your mind, is the biggest problem with that?
Yeah, so I think the problem of any tax increase, and then I'll get to certainly on the wealthy in the moment here, is all a tax increase is at the end of the day is it's a tax on the whole economy. So I think one of the biggest things that the left does that really is it's just a lie. It's just a complete lie, and it's why the economy is so poor it is right now, why inflation's so high, why wages haven't been keeping up, is the left has sold this bill of goods where don't worry about it. I'll just tax the wealthy. I'll just tax this person. I'll tax companies and you won't feel it. And that's utter crap. So what happens in real life is when people that have more money or corporations are taxed, it flows down to everybody else in the economy. People that make a lot of money when they get taxed means that money isn't invested. They don't really feel it. It's actually people who are at the lower end who need a job, who need to move jobs to get higher wages. That job opportunity no longer exists. Same thing if you tax companies. So, what we're looking at here is, frankly, I was saying before, why are we in the mess we're in? Social Security steals 12.4% of everybody's paychecks because what you've got here is a situation where not just that, but Medicare and every other tax the left has given us saps the growth of the economy. It makes it so that there are fewer job opportunities, that wages don't grow, that we don't grow more productive capacity, that we don't adopt more innovative technologies. So if we just raise taxes, what you will do is burden not the wealthiest Americans, but most Americans. We'll all be poor, our wages will be lower, and it'll be, the snake eating its own tail on this one. And so even if you tax the wealthy on this, it flows down to everybody. And that's the problem.
All right, last question here for you then. If this is a problem, and everybody seems to know that it's a problem, there are different ways of approaching how to solve the problem. But if everybody knows this is a problem, at what point do we solve it? Like, we all know Congress doesn't do anything without a deadline until they absolutely have to. They like to walk up to the edge and look over the edge and see how far down it is before they work something out. Does it come to that? Does it come to 2 years before insolvency, year before insolvency, we try to figure something out? That's what it's going to take for Congress in order to get this thing fixed?
I think you hit the nail on the head the way the Congress works, unfortunately. So what I would say, though, is, there's one other thing about this, though, and it may very well be that in the year before, the Social Security checks are about to go out, that's a lot of high drama, and something gets done. But I'll give you, I think, the scarier thing. So Congress does one of two things. What you said, they do at the last minute, or they just do the frog boiling in the pot analogy, and that's the federal debt. So, we're $34 trillion in debt. It's $260,000 per household. Again, it's why you have inflation. It's why interest rates are through the roof. That's the other solution, is the Congress can simply say, well, I don't want to vote to raise taxes or vote to cut benefits. You know what I'll do? I'll just simply print the money at the Fed and let the Fed fund the deficit on Social Security. And that looks like a subtle change. And they're going to come out probably and say, oh, don't worry about it. We got this really one quick trick, to fix Social Security. But what that's going to do is every other thing they've done for the last 20 years, which is where they said, you don't want taxes, you want to cut benefits, don't worry about it. I got a magic money machine in the basement of the Fed. And that's where the inflation comes from. That's where the interest rates come from. It's where the generations long sluggish economic growth comes from. It's why most people can't afford a home these days. So that's actually my biggest fear, is not frankly even that Congress will do something dumb in the last minute. Don't worry, they probably do that anyway. But it's that they'll do this, right? That they will keep boiling the American economy like the frog in the pot through more inflation taxes, through more printing of bad money that chases out the good from the Fed, burying the economy the way that Japan has had lost decades, the way that Greece has had lost decades in a debt crisis. So that's my biggest worry about what they'll do.
Well, it's clear there's a problem, and certainly many different ideas on how to solve it. We'll see what the kind of timeline and what we're looking at here over these next few years as we try to figure out Medicare and Social Security. Richard Stern from the Heritage Foundation, thank you so much for joining me here on the DC Debrief. I really appreciate it.
Pleasure. Thank you so much.